ceremony. We're so excited to recognize all of the graduating dental public health residents. I am going to put the agenda into the chat box if you'd like to click on that link. And so you would be able to access the order of events today. And so first, I would like to introduce Dr. Thanos Stavros, who will be sharing some words of welcome.
Great, thank you, Annalise. I wish to welcome you all in this ceremony. It is my distinct pleasure and honor to appear before you today to congratulate you on your achievement on behalf of the American Board of Dental Public Health. You are a unique class of graduates. You dealt with adversity. You did fought the pandemic. Some of you, you continue to be doing so. And yet you managed to complete your requirements and to graduate. So congratulations. I will be brief. In addition to my congratulations, I wish to introduce the concept of the American Board of Dental Public Health to you and to invite you to go through the examination process. The American Board of Dental Public Health was incorporated under the laws of the state of Colorado in July 1950. Dental public health was recognized as a dental specialty that same year in October of 1950. Subsequently, the American Board of Dental Public Health was designated as the National Examining and Certifying Agency by the House of Delegates of the ADA in October 1951. The specialty and the board were reviewed in 86, 2001, 2012, and most recently 2021. I will close by describing what the purposes of the board are: to protect and improve the public's health by the study and creation of standards for the practice of dental public health in all its aspects and relationships, to grant and issue dental public health certificates to dentists who have successfully completed the prescribed training and experience required, and to ensure continuing competency of the diplomates. So let me say a big, from the heart, a big thank you for your service to dental public health, for becoming specialists. And the board is waiting to see your applications soon. Take care.
Thank you so much, Dr. Stavros. Now I would like to turn it over to Dr. Frances Kim.
Hey, hi, good afternoon, good morning to everyone. I'm not sure if I am on camera. Oh, there I am. Okay, thank you, Annalise. It was weird. I feel like I was just talking to Thanos. I'm Frances Kim. I'm the Executive Director of the American Association of Public Health Dentistry. I'm here on behalf of John Warren, who is the president of AAPHD. Unfortunately, he's unable to join you all today. So first, I would also like to extend a congratulations to everyone on completing your residency program in challenging times, as Thanos had mentioned. I was thinking about myself and going through a program years ago, and then could I have done the same? I don't know. So congratulations to you all. So I want to say that first. And I also want to just let you know that AAPHD is here for you. If some may not be fully aware or understand the relationship with AAPHD and the American Board of Dental Public Health, but we are the sponsoring organization for the American Board of Dental Public Health. And as you know, that is one of the specialties that's been recognized by the ADA. So we are here to support the specialty and the specialist of dental public health, but we are also an organization where we are here to support all of dental public health, the area, the practice of dental public health. So I just want to let all of you know that there are opportunities for you to participate in our councils. I know there are some already who have reached out to me, and we welcome you and your fresh ideas to the organization. So please do not hesitate to reach out to myself. The information's on the AAPHD website. You can also reach out to your program directors to get my contact information. As I think almost all of the program directors here on the on today's call. So Zoom celebration. So that's all I really want to say, and I hope you have enjoyed today's ceremony or celebration rather, and hope you are also able to enjoy some of the summer after a long, hard year of work during this challenging time. So thank you, everyone. Thank you, Annalise. Thank you, David. And I will turn it back to you, Annalise.
Thank you so much, Dr. Kim. We appreciate WAPHD's support. And I would like to share a few words on behalf of AIDPH. Hi, for those of you who don't know, I am Dr. Annalise Cothran, Executive Director of AIDPH. And on behalf of the American Institute of Dental Public Health, we want to extend our warmest congratulations to the 2021 Dental Public Health Residency graduates. We are thrilled to host the ceremony in support of our collective chosen profession and community. Usually by this time, we've had the pleasure of getting to know many of you personally, as you would have participated in our residency programming, like our federal service internship or our academic leadership programs. And while we weren't able to connect through our Hallmark programming this year, we are still excited to support your growth as residents by honoring you during the ceremony, and look forward to continuing support of your professional development as you matriculate into the dental public health workforce. We also want to thank you for your dedication to oral health and congratulate you for embarking on a rewarding career path. And I extend sincere gratitude and appreciation from all of us here at AIDPH. So before I hand it off to Dr. Caperl as our ceremony host, I want to provide just a couple of housekeeping points. First, we are asking the audience to keep your videos off for the entire program, because that will help me to spotlight our graduates more quickly when they are recognized and acknowledged. Each program will be recognized by the program director, and as the ceremony continues, we'll be asking for recognition of the graduates as a program group. At that time, you may unmute and clap or cheer to honor our residents. Please keep your videos off, but you may unmute your audio. And then afterwards, please mute again to reduce background noise for the next program. You can also use the clap reaction feature in Zoom if you would like to. Lastly, as you already know when you entered the room, this ceremony is being recorded and we will publish it later via the AIDPH YouTube channel. I am now pleased to hand off the virtual microphone to Dr. David Caperl, who is the chair of AIDPH Board of Directors and the co-founder of AIDPH. Thank you, Dr. Caperl.
Thank you, Dr. Cothran. And let me add my congratulations to each of you. We are celebrating your success today, and it's our pleasure to do so. And thank you all who offered a welcome. Appreciate that as well. We are pleased today to welcome Rear Admiral Timothy Ricks. Rear Admiral Ricks is the Chief Dental Officer and the Assistant to the Surgeon General. He advises the U.S. Department of Health and Human Services on all aspects of oral health in the U.S. Public Health Service. Rear Admiral Ricks began his career in Pyramid Lake, Nevada, with the Indian Health Service. And I always note that because my new home is here in Nevada, so I always want to spotlight that and recognize his appreciation of the state. Prior to his selection as Chief Dental Officer, Rear Admiral Ricks served as the Deputy Director of the Indian Health Service, Division of Oral Health. Rear Admiral Ricks is a diplomate of the American Board of Dental Public Health. He is a fellow of the International College of Dentists and the Senior Scholar of the Santa Fe Group. It is our pleasure to have Rear Admiral Ricks join us today for a few words. Thank you.
Thank you, Dr. Capelli, and thank you to the American Institute of Dental Public Health for the invitation to speak to all of you today. And especially thanks to AIDPH for holding this now annual event, recognizing all of the DPH graduates. I would like to start by, of course, joining my colleagues to congratulate each and every one of you for this monumental achievement in graduating from your public health residence, dental public health residency. As Dr. Capelli mentioned, I am a dental public health residency graduate myself and a diplomate of the American Board of Dental Public Health, and I highly value and respect your commitment to dental public health. A year ago, when I spoke at this inaugural ceremony, I talked about the then novel coronavirus, which at this point last year had just caused 400,000 deaths worldwide. A year later, we've now surpassed 600,000 deaths in the US alone, with over 33 million cases in our country. And worldwide, we've had 4 million deaths and 180 million cases. So even as we celebrate now some of the decreases we've seen globally, and especially in our country, in the number of cases and the deaths, we know that we must remain vigilant because there are new variants that continue to be a challenge and threat to all of us. Public health has been at the forefront of this pandemic, and if anything good has come out of it, it has been the renewed emphasis on oral health integration with overall health. This makes sense, of course, to all of us, as you cannot separate the mouth from the rest of the body. For decades, we've known about the links between oral diseases and systemic diseases, from things like cardiovascular disease, lung disease, cognitive issues, pregnancy issues, and other inflammatory processes. We've also seen linkages between the oral cavity and COVID-19 as well. And we know that oropharyngeal cancer now is the top HPV, human papillomavirus attributed cancer, surpassing cervical cancer, meaning that in the very least, we have a role in providing education to our patients about HPV vaccination, and perhaps in the future, actually providing vaccinations for HPV. With the pandemic, oral health professionals have played a very important role, and some of you have as well, in doing COVID testing, doing contact tracing, staffing mass vaccination clinics, and also doing COVID vaccinations. But we have a more broader and important role in overall health, including point of care testing for chronic diseases, including depression, hypertension, high cholesterol, diabetes, and much more. The main thing to remember is that we are healthcare professionals first and oral health professionals second. There are 31 million Americans in the US that see a dentist each year, but not a medical provider, including 700,000 children under the age of 4. So there is a tremendous opportunity for all of us to get involved in screening and educating patients about overall health issues. We have to collectively break down or continue to break down the silos that exist between oral health and medicine, but also within our profession itself. Breaking down silos starts and ends with relationships. It also starts with interprofessional education and interprofessional collaborations. You can't expect our medical counterparts to quickly jump on board on oral health integration, as they face some of the same workforce strains that we do in our profession. Like I said, it takes relationships to break down these silos, and each of you as a new dental public health graduate has a responsibility in building collaborations throughout the healthcare system. So as we begin to hopefully rebound and reemerge from this public health crisis, I know that each of you will emerge even stronger, more resilient, and ready to tackle all the challenges ahead. As dental public health professionals, you will be hopefully in high demand as you look upstream to plan and manage oral health programs, evaluate and recommend improvements to dental care delivery systems, conducting oral health surveillance to determine population-based disease burdens, conducting research that will advance all of our knowledge on oral health topics, and most importantly, serving as an advocate for oral health and public health for many years to come. But we all know that dental public health is not an easy road. You'll face many challenges along the way, and you know many of these challenges. But let me talk a little bit about what some of these are. First of all, we know that the demand for oral health care continues to increase in this country. Some of you are entering the job market perhaps for the first time. Some of you have been working for many years, but there are now 200,000 other dentists that are providing oral health care in America, but only a very small portion, a small number with the credentials you carry now as a dental public health specialist. In just the past 20 years, we've seen a 22% increase in the number of active dentists in the US, but yet we still have an access to dental care problem in this country. We know that new dentists coming straight out of dental school are bringing with them almost $300,000 in debt on average. And we know that dictates where they go once they graduate from school. We've seen the number of dental health professional shortage areas, or HPSAs, remain pretty stagnant for the last 2 decades as a result. That's why we need each of you as a public health specialist to objectively look at the value of alternative dental workforce models to address the access issue. Models such as dental therapy, expanded function dental assistants, community dental health coordinators, community health workers, and independent or associate practice dental hygienists are all possible solutions to the access to care problems. And again, we have about 60 million people, according to HRSA, that live in these so-called dental deserts. Health equity has moved to the forefront in the national conversation recently, and this is yet another challenge for us as we move forward. We must recognize the oral health disparities that exist in this country and what makes these disparities inequities. Access to affordable, culturally competent, and high-quality dental care is not even across this country, as we know. And people of color, people living in rural areas, and people living in poverty suffer disproportionately from oral disease. Our job as public health professionals is to recognize these issues and address them through policy, through advocacy, and through action in our respective roles. At the same time, we must be committed to addressing structural racism that exists in our society and in our institutions. We need to break down the idea of always selecting people who think like us, look like us, and act like us in our organizations, our committees, our teams, and our projects. Another challenge we face is the aging population. Over the next 2 decades, the number of adults over the age of 65 will grow to more than 70 million people, double what it was at the turn of the century. There's been a huge push, as you all know, toward improving the number of states, increasing the number of states providing comprehensive adult Medicaid dental benefits, which is currently at, I believe, 19 states, and establishing a first ever Medicare dental benefit. And this push is going to continue for the foreseeable future. As we've seen with COVID-19, emerging public health threats, continue and will continue to pose another challenge to all of us. But as I mentioned, it's also an opportunity. Many threats such as e-cigarettes, smoking, substance abuse, the HPV-attributed cancers, and more have associations with oral disease or oral health. With the release of the first and only Surgeon General's report on oral health back in 2000, we made a statement that oral health means much more than just healthy teeth, and that it is integral to the overall health and well-being of all Americans. In fact, we know, all of you know, that you cannot have overall health without first having oral health. And as we welcome you into the dental public health world, we know that each of you, through your respective programs, have been given the knowledge, skills, and abilities to emerge as leaders within your communities, within organized dentistry, and within the profession and discipline of dental public health. Each of you has received a high-quality dental public health residency experience. Your knowledge, skills, and experiences will pay off for many, many years to come. You'll be the key in promoting key public health concepts, such as the need to improve public health infrastructure at the local, state, and national level, promoting alternative workforce models and other solutions to address the access to care issues and oral health inequities, and promoting the cornerstones of dental public health, such as oral health surveillance, community water fluoridation, oral health literacy, and evidence-based dentistry. Each of you, I'm confident, will embrace these challenges ahead, and your success in the future will depend in large part on your ability to educate and inform others about upstream public health issues affecting oral health and your ability to influence change. I see and hope for a bright future for all of you in dental public health. So once again, congratulations to all of you on your graduation from dental public health residency programs across the country. I wish you much success in the future. I also want to thank all of the residency directors and faculty for shaping these students and ensuring a future for our specialty. Thank you very much. Now back to you, Dr. Caperl.
Thank you very much, Rear Admiral Ricks, and I appreciate your presenting all of us with a challenge and a vision for the future. Thank you very much for that presentation. It's now my pleasure to introduce each program director, and I will ask each program director then to introduce their graduates. And please, as you're introduced, turn on your video so that you can be seen. And so we'll begin. Dr. Jeffrey Chaffin, the program director at A.T. Still University, Missouri School of Dentistry and Oral Health.
Thanks so much, Dr. Caperl, and thanks to AIDPH for sponsoring this. So our graduate this year, we can go to the next slide, is Dr. Antonina Caperl. She's currently the state dental director in Nevada, and she has been doing that position during this 2-year combined MPH and residency as well, as our program is a virtual program. So her quote is that her favorite memory during the program was participating in the Dental Public Health Board preparation workshop with other residents and then passing the written examination. So congratulations to her on passing the written examination and on completing our program.
Congratulations, and thank you, Dr. Chaffin. Next is Dr. Mary Tavares, the program director at Boston University.
Hello, thank you very much for AIDPH and Dr. Caperl and Dr. Cawthron for putting this on again this year. I'd like to introduce our graduates, Dr. Hema Kumar, who is, I believe, is present today, and she would like to further her knowledge in community-based work and work in a clinic and apply her research knowledge because she's been our star researcher this year. Then Dr. Pallavi Karpi, and also we have been virtual all year. That is not the nature of our program, but all of these folks have carried on just an amazingly good job. And Dr. Pallavi's on too. Dr. Khalid Khalif, I think, is on as well. And again, he has carried out a great job from his home in New York City, and we've managed to put lots of work in this year. And Dr. Cam Van Hune, who I think is not on because she's probably seeing patients in somewhere at the Indian Health Service in New Mexico. But she has been particularly challenged working at a COVID unit at times and trying to keep up with the program virtually. So kudos to her for making it all the way through and taking the written exam as well as the others did, and moving forward in our profession. Dr. Majinder Kaur, who I know is not on today, who also did the master's program with us. So she's been with us for 2 years, this second year virtually, and also challenged the exam and is also ready to move on. Dr. Mohammed Al-Shari, who I think was our most distant student because he stayed in Saudi Arabia all year. And we fabricated programs and field projects for wherever students were located. So thank you for all your flexibility and the good work you did. And that's it. Thank you.
Thank you very much, Dr. Tavares. From the Centers for Disease Control and Prevention.
I'm sorry, can we pause momentarily and ask the residents to turn their cameras on so we can acknowledge them as a group?
Okay.
I just wanted to make sure we had the ability to say hi to everybody in Dr. Tavares's program.
Right. So
if you are in Dr. Tavares's program, please turn your video on and I will spotlight you so that you can be acknowledged as a group.
Should be at least 4 of you there. Mohammed, Khalid. Here we go.
And if anybody would like to unmute and clap, you can also feel free to do that. We want this to be a joyful experience for everybody.
Yay, congratulations, everyone.
Congratulations.
Thank you.
Thank you.
And congratulations for everyone, my group.
Okay, our next program from the Centers of Disease Control and Prevention, the program director, Dr. Gina Thornton-Evans.
Good afternoon, everyone. I think Dr. Jorge Bernal is on. Annalise, could you just check to see? He may be having some trouble. I know I saw him on.
Yes, he is on.
Okay, great. Thank you, everyone, and thank you to Dr. Capelli and Dr. Contron for putting together this program. I think it's really excellent. And I would like to introduce our graduate from CDC Division of Oral Health, Dr. Jorge Bernal, and his note is that he would like to show his appreciation to the staff in the Division of Oral Health at CDC and give special acknowledgments to myself as the program director, but then also Dr. Eugenio Beltran, Dr. Susan Griffin, and Dr. Aaron Hamilton for their invaluable help in his journey in the dental public health residency program. And only want to add that Dr. Bernal did the program part-time and he was able to really accomplish some great things. And I'm very, very proud of him. He was also able to publish one of his projects that he'll use for the oral part of the board. And it focused on GIS mapping, along with looking at the dental safety net in the state of Georgia. So I'm really proud of him to have pretty much a full-time job that allowed him to work part-time for the residency for the past 2 years. Thank you, Dr. Bernal, and congratulations.
And Dr. Bernal, if you'd like to turn on your video, we can celebrate you together from this program. Thank you. Congratulations.
Congratulations, Dr. Bernal. So our next program to be recognized is the program at Case Western Reserve University. Unfortunately, the program director, Dr. Sena Narendran, was unable to be with us today. So it's my honor to recognize the graduates of his program. Dr. Sweta Mathur would like to thank Dr. Narendran for his guidance and support throughout the residency program. And congratulations on this accomplishment, especially in a time of COVID. We recognize the difficulties associated with that, and this is quite an achievement. The second graduate of the Case Western Reserve University program is Dr. Jaspreet Cower. And Dr. Cower said, I would like to acknowledge my residency director, Dr. Sena Narendran, my family and friends for their continued support and guidance. And again, Dr. Cower, congratulations to you as well. I ask that everybody give those two recent graduates a round of applause for their accomplishments this year. Thank you both.
Thank you.
Thank you.
Okay. Congratulations. Our next program and our program director is Dr. Samantha Jordan, who is the program director at the Harvard School of Dental Medicine. Dr. Jordan.
Hi, I am so excited to be able to introduce our graduates from the Harvard program. Our students are always exceptional, but have really shown a lot of resilience and flexibility, and I've just been so impressed to be able to work with them this year. And our first recipient is Dr. Dania Bedelia. And she says, after graduation, she plans on teaching and working on improving primary dental care infrastructure in her home country, Saudi Arabia. And we are lucky she is staying on board to receive her doctorate degree. So we get her for one more year, but she's completed her dental public health certificate. And Dr. Kobe Gordon, he finished the program this year. He received both his certificate and his master's in dental education. And he would like to acknowledge Dr. Mary Tavares, who has been his main cheerleader since the day he interviewed at our program. So big thanks to Dr. Tavares from Dr. Gordon. And we also have Dr. Abir Abdullah. And she would like to thank her amazing parents, her brothers, and her sister for their continuous love and support. She is really grateful for her amazing colleagues and all of our faculty, including myself and Dr. Shamit, for always supporting her and being there for you. And we are also lucky to have Abir for one more year as she completes her doctoral degree. And we also, I just want to add Dr. Hisham Al-Hazmi. He also finished our program. He received his doctorate degree this year. So I want to acknowledge him as well. Congratulations.
Congratulations.
Thank you.
Our next program is from the University of North Carolina at Chapel Hill. The program directors are Dr. Jane Weintraub, Dr. Alex White, and Dr. Rhonda Stevens. And Dr. Weintraub, I understand, will be recognizing their resident graduates. Dr. Weintraub.
Thank you. My pleasure to be here with you today to introduce our graduating resident, Dr. Amrita Bhanat. She like everyone else, completed her residency during this challenging year. The residency program is based in Raleigh, North Carolina at the oral health section of the North Carolina Department of Health and Human Services, with a long-time affiliation with the University of North Carolina, Chapel Hill. And now we also have faculty from East Carolina University on board as well. So we really cover the state with our residency program. And Mita has really strong research skills. Her master's in public health, that was also from UNC, from the Gilling School of Global Public Health. She had her concentration in biostatistics, which is a little unusual for some of our residents. And of course, her residency project was a really strong research project looking at changes in self-rated oral health status over different time periods among older adults. Her statement here that she'd like to thank her mentors, myself, Dr. White, who was the residency director for most of the year until he retired at the end of February, Dr. Moss from ECU, Dr. Stevens, who's been the primary residency support person and advisor at the health department, and who we anticipate will be the new residency director, as she's now officially a diplomate of the board, for their guidance and support throughout her residency. She says, this year has been challenging, but they have encouraged me to stay strong, positive, and to make the best with what we have. I'd also like to thank my family and friends for always being by my side. And I believe Dr. White is on board today, and I know I see Amrita's face on my screen too. So congratulations to you.
Thank you, Dr. Weintraub. Thank you, everyone.
Congratulations.
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 I would like to now introduce the next program and the next program director, Dr. Marisol Teles, from who's the program director at Temple University. Dr. Teles? Well, let me introduce the resident. From the program is Annalise, is she available?
I'm not seeing Dr. Teles here. So
Okay.
perhaps you could introduce her residents on behalf of her program.
I'll be happy to do that. First is Dr. Herving Henriquez. And Dr. Enriquez would like to acknowledge Dr. Teles, Dean Ishmael, Dr. Beltran, and his fellow residents for the program. Congratulations, Dr. Enriquez, on your accomplishments. The next resident graduate is Dr. Vamsi Narasetti. Again, congratulations to you. He would like to send a special thanks to the program director, Dr. Teles, for giving this opportunity, and to Dean Ishmael and all the other mentors who have given their extensive support to accomplish his goals. And so with that, congratulations. Dr. Ratna Balavarapu, congratulations to you as well, and my apologies if I have mispronounced any of your names. I apologize. So Dr. Balavarapu stated, when I started my program in September of 2020, my parents, my brother, and my cousins were critically ill and hospitalized due to COVID-19. I can never forget the support I received from our program director, Dr. Teles, and Dr. Bhupati during the most challenging times. That certainly is a huge challenge. I hope your family are well, and that they can celebrate these accomplishments with you. Dr. Anubhav Jain, I would like to acknowledge my parents and my siblings who have been a constant support to my endeavors and dreams of studying in the United States. Congratulations, Dr. Jane, and congratulations to all of you on your accomplishments during this most difficult time and faced many challenges. Congratulations to you.
Thank you.
Congratulations.
Thank you.
I'd like to announce our next program director from Texas A&M University School of Dentistry, Dr. Peggy Timothy. Welcome, Dr. Timothy.
Thank you, Dr. Capelli and Dr. Cawthron. Today, I want to recognize and celebrate our graduate, Dr. Darnell Thomas. Dr. Thomas is Lieutenant Commander of the U.S. Public Health Service. On behalf of the faculty and staff of the Public Health Sciences Department, we wish Dr. Thomas much success as he continues the path of dental public health. Dr. Thomas, his quote is, he wants to thank his family for love and support throughout all of this. He also wants to say a special thanks to me, Dr. Bertuni and Burdett. He wants to thank Ms. Lovecamp as well as the rest of the DPH staff and faculty at Texas A&M College of Dentistry for all their support throughout the program. He couldn't have done it without us. Thank you so much, Dr. Thomas.
Thank you.
Congratulations.
Congratulations. So Dr. John Warren, the program director at the University of Iowa, was unable to attend today's ceremony. I have the distinct honor to recognize the program graduate from Iowa, Dr. Marouk Zafar. Congratulations, Dr. Zafar. Dr. Zafar said, my favorite memory from the residency was my project with the Oral Health Forum of Heartland Alliance. And it was before COVID, and I went to Chicago to learn about the Heartland Alliance program. I absolutely loved the team, their enthusiasm and dedication. Congratulations, Dr. Zafar, on your accomplishments, and we recognize your work. Thank you so much. Our next program is the University of Rochester Eastman Institute of Oral Health, and we want to recognize the program directors there, Dr. Sangeeta Gahendra and Dr. Victor Badner. And Dr. Gahendra, I'll let you introduce your residents. Thank you.
Thank you, David and Annalise, for hosting this event. It's really an honor to celebrate this event and congratulate our residents. We have 3 residents at different sites, 1 at Jacobi Medical Center and 2 at Eastman Institute for Oral Health. Our first resident that you have is Megan Cloyd. She completed her residency at Jacobi Medical Center. Her site director, Dr. Victor Badner, is here, and I'm sure would like to say a few words about her.
So Dr. Cloyd was really a tremendous resident, and so tremendous that we decided to keep her. We have a HRSA grant, and we've hired Megan to be involved in our HRSA grant, which involves interprofessional education. And she is the leader at our institution on teledentistry and the development of teledentistry in our program. So we're really thankful to her for all of that. And her research project was on HPV vaccination potential in dental offices. As Dr. Rick said, given the time of COVID, we realized what dentists can do, and Dr. Cloyd is furthering that with her research and policy related ideas around HPV vaccination and dental programs, and we're excited about that. And on another note, to all of the participants in this event, I want to thank all of you who participated in our conference call this past year. It was really a tremendous activity for the authors of the new book, the new edition of the Burton Eklund book, and for all the residents who participated in that. I really thank you for your wonderful participation this year, and congratulations to all of you who completed your residency, and to Megan for completing and for passing the written portion of the boards. Congratulations.
Our next resident is Procedura Canal. She graduated from the Eastman Institute for Oral Health in Rochester. Her words here are really very touching. She has talked about me as her mentor, and that I have supported her both personally and professionally, and that she has learned new perspectives in applied dental public health and acquired life skills that will be valuable in her future endeavors. She literally took time to be available, she's talking about me, to support her and answer her calls. It felt like a family, and I would not be able to flourish with her guidance. One thing about Prashida is that she's so humble, down to earth. I don't know if you all are aware, but she is the state dental director in Minnesota. And we never felt that she was here with high skills and knowledge, but she was really here to learn. Congratulations, Prashida. Our next graduate is Dr. Namrita Bhanat. I do want to say this about both of them, and even Namrita in particular. The hard work and perseverance and her drive is so inspiring. Well done. We need more people like them in the field of dental public health. Good luck for a very, very bright future. Thank you. Congratulations.
Congratulations.
Congratulations to all of you, and looking forward to seeing what you accomplish in the future. Thank you, Dr. Badner and Dr. Gahendra.
Thank you.
Our final program is the program at the University of California at San Francisco, represented today by the program directors, Dr. Enihomo Ubadan-Odo and Dr. Howard Pollack. Dr. Howard Pollack is here to present or to recognize the residents. So thank you, Dr. Pollack.
Thank you, David. It's an honor and a privilege for me to be here speaking on behalf really of Dr. Eni Ubadan-Odo, who I took advantage of the fact that she's on maternity leave to come back as interim director. I also want to say something about AIDPH as a previous board member, and the efforts of you, Dr. Caperl, and Annalise Catron, and the other board members. This is a wonderful celebratory event, and it speaks largely to the collegiality of our profession and this particular specialty. I'd like to introduce the residents who are completing their program here out on the West Coast. First of all, I'm Rita Givagis. I'm going to read the titles of the research projects and their mentors, if I may. Each completed 2 research projects. Amrita, her first project under the mentorship of Israel Agaku is the smoking status of healthcare workers associated with their perception towards providing tobacco cessation counseling. This was a national level survey. And then under the mentorship of Stuart Gansky, correlates of parental psychosocial factors on oral hygiene among children of low-income families, multi-level cross-sectional study. I want to recognize the tremendous work that Amrita did this year. So congratulations, Amrita. Next, I will go to Vaishali Sundararajan. Order, but sort of randomly placed here. Her projects under the mentorship of Alpha Yansani was barriers to dental care utilization among children lacking follow-up care within after-school dental screening programs. And then the second project, under the mentorship of Kristen Kearns, qualitative study analyzing various dental professional organizations' policy statements on sugar and suggesting strategies to benefit the prevention of dental caries. I want to congratulate Vaishali and all the hard work that she's put in this year. So congratulations to you, Vaishali. And then our next one is Dr. Prashantha Patel. And I'm going to read her research projects, and you can see that she's also added some comments there on the slide. So under the mentorship of Beth Mertz, Elizabeth Mertz, project Teledentistry in a post-COVID-19 world, assessing adoption, integration, and policy. And then the second project under the mentorship of Benjamin Chaffee was e-cigarettes and self-reported oral health in US adolescents, finding from population assessment of tobacco and health study. So congratulations to you, Prashantha. Again, wonderful to work with you this last quarter. So she said some very nice things, which you were able to read on the slide. And then finally, not least, is her research projects under the mentorship of Jing Cheng were exploring the associations between psychosocial distress, smoking, and oral health among Hispanics and non-Hispanic Black teens and adults in California. And then the second project under the mentorship of Anne Lazar, barriers to care experienced by the UCSF dental patients during the coronavirus pandemic. So congratulations to you, Hasini, as well. And she says some very nice things about us all there. You can read for yourself. And I see that Annie is on the screen as well. And Annie, if you could unmute, you might have some additional comments.
Thanks, Howard. Not much to say. I have a sleeping baby right here next to me. So just congratulations to all the graduates, Namrita, Vaishali, Prashantha, and Hasini. I'm so proud of you all. And I can't wait to see what you would accomplish with your dental public health careers.
And congratulations to you, Annie.
Thanks, Dave.
Congratulations to all of you.
Thank you.
Well, with that, we conclude the ceremony. But I want to offer my congratulations to all of the graduates of the DPH residency program across the country. And I ask all the attendees at this time to unmute and join us in celebrating the amazing accomplishments of these new graduates. Thank you all for attending, and ask you to unmute and share a little time together.